before you put this back in.
Okay.
So what you can essentially do to keep it clean and safe,
While it's soaking, you can
let that stay and do your stoma
Clean.
care.
That's how she did it. She
Okay.
had soaking, and then she did the care.
Okay, so go through as if we just suctioned,
Okay.
right?
We haven't put those gloves on yet.
Right. So
Gotcha.
we started off, we suctioned out the trach, pulled out the inner cannula, dropped it in here. Let's say the patient's not on a vent, they're just on a trach collar. Okay? Pulled out your dressing, like it says after suctioning. Then you're going to go, and if you jiggle the stuff around, you can grab things from here, because you're going to just do it as a clean procedure around there. Okay? So then let's say you take one of these guys, do your cleaning. You want to inspect and look, make sure there's no scoriation or
Bruise or
breakdown or
anything.
redness or any bleeding or anything going around or any pus or anything crazy. Make sure that's clean. Then you can use a gauze. You can pull one from here to wipe and dry, and new ties. So when does it say to do new ties? Afterwards.
You clean around the hole inside as well,
If you see stuff, it should be pretty clear though, because of the cannula is in there and it's pretty tight to the wall, so there really shouldn't be much junk in there.
Inside.
Unless the patient started coughing or something when you were here, then you can always get a suction catheter and just suck right out in there, because it'll fit. Okay? So you cleaned your whole area, make sure everything's good. Then you can go over, change your gloves, go through cleaning here, rinsing, making sure it's shaked off, and then put it back in.
You usually change your gloves. Are you going back to sterile
So
gloves?
how many
Right.
gloves do you really need? Like 3?
No.
For suctioning?
Well, you're going to
For
do one
cleaning.
for suctioning, because you're going to get the gloves out of the suction kit.
One.
Right.
And then you put the other gloves on, which is 2.
And that should be it. Because
That's it?
once you
Okay.
clean, you put these gloves on, and this is all scrubbed and clean, and you put this in, you can keep those same gloves on to put the new gauze on and
Got
change
it.
the ties.
That's 33 pairs to me.
2.
Just 2.
The one that comes for suctioning,
Right.
And then-
okay?
But then,
Then
right.
you're done suctioning.
Oh, then you're keeping those
keep
on.
those on,
You
but
change
it's
to
not
here,
sterile
because now
anymore.
you're
So
clean
you
this.
can actually take the gloves that you have on from suctioning to get what you need from there initially, as long as you don't touch other stuff.
Right.
Okay.
And then you really are only changing that to pick up that to clean it.
Right,
And
and
then
then
you
you're
find
cleaning
it.
it,
And
and
then
then
you can
those
use
gloves
them.
are okay, because you put the cannula back in, so now you can put your new gauze on
Okay.
and change your ties.
Ken,
Yes.
you can suction you said if there's some gunk still in there when you take
Right,
the
so say
without
you
the
take it off.
cannula though,
With a yank
Yes.
bar. Oh.
No, you can use this.
just at the ends.
Right, so if you have it out, right, and it's doing its thing over here, and the patient starts to cough, you'll have to get another suction catheter. But then you can just go right in here and suck it out.
Oh, just at the beginning
Just
of
in
the
the
Right.
tube.
You don't want to go
Right.
all the way down.
Yeah.
You just want to get whatever they coughed out right here.
Okay.
Okay? And then you'd have to get rid of that stuff and go back to where you're at. Okay? Does it make sense? Okay?
Put that
So we're
in.
going to have to
So
change
you're
out
at
the
a-
collar though for our check-off.
The ties, yes.
Mhm.
So you'll take the new gauze from here, put the new gauze in, because that's the steps that they're using in here. Replace this dressing with a sterile pre-cut gauze. That's after you clean and put it back in. Then it says removes old ties or holder and replaces with a clean one. So after you do that, you can do your thing where you're holding your, take this guy off, the other one on, take that side off, bring it around, hook it up, and then you're done. Then you want to
So
make
how do
sure
you-
it's
how does-
secure.
Can we do it?
Yeah.
Yeah, that's what I want you guys to do it.
Okay.
Oh, okay.
Yeah. So you're going to get this guy back underneath. This is really tight compared to what you should be. How tight should this be?
one
Yeah,
finger.
One finger.
finger.
One finger.
Okay. So then you always want to make sure you're stable on the tray. So this guy you could take apart, right?
Mhm.
So you want to keep a hold of the flange, use your other hand, pull that guy off. Remember, Ann, we did this the other day? Get one side on, then you can pull this through while still maintaining wanted to do everything. See, now this guy's got the flexible flange, some of them don't. So this one makes it a little bit easier because you can flex the flange a little bit to get that in.
Oh, I see. Yeah,
See what I'm
sometimes they're
saying?
hard and you can't.
Some of them are hard and you can't, so you kind of got to like maneuver it a little bit. So then while you're still maintaining your trach in position,
I'm gonna need 2 more victims in an hour. What are they
you
doing?
get this,
Practicing.
Oh, cool.
I'm just doing the.
and then you can cut this or fold it back however you think.
Okay.
And then there you go.
Okay, in about an hour, I'm gonna need 2 more victims to go to the nursing lab.